Called our last full Board of Commissioners regular session for the year 2025 today, Tuesday, December 16th, 2025, to order. Please stand and join me in the pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Is there anyone from the public here who would like to make comment? Hearing none. We have the board meeting agenda. Are there any additions or corrections?
None today, Mr. Chair.
I would entertain a motion to approve the agenda as printed.
Motion entertained.
Okay, we have a motion by Commissioner Schmidt. Do we have a second?
I'll second.
Second by Commissioner Van Ort. Any discussion? Hearing none. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Andrew, our consent agenda.
We have a
please. Yes,
healthy consent
you
agenda today, Mr.
do.
Chair.
And resolutions within, just as a
Did you
warning.
offer a public comment?
Yes, I did.
Did you? Oh, we're moving.
We have approval of the December 2nd board meeting minutes, approval of the Health and Human Services County and Hospital accounts payable,
I saw that.
approval to set a public hearing for a transportation local option sales tax, approval of the general fund advances to cover deficit fund balances at the end of the year, acknowledgement of change funds in various departments, resolution establishing the fund balance policies per GASB 54, reappointment of our Veteran Service Officer, Tim Steinert, approval of agreement with the Minnesota Housing Finance Agency for the City Participation Program, approval of the Cedar Mills Gun Club temporary on-sale liquor license, approval of the 26-27 Snowmobile Safety Enforcement Grant Agreement, approval of the 25 through 27 Off-Highway Vehicle Safety Grant, approval of a proposal to upgrade pneumatic to new direct digital controls for AHU S2. And that is the consent.
Almost one half of the alphabet today.
Almost.
So are there any questions on any of the items within the consent agenda, or do you want anything moved to the regular agenda?
I just have a question on that, AHU S2.
Yep.
Where is that one at?
It's the jail.
Okay. That is in the budget and everything.
It's in the budget. Yep.
We've-
And it
And came in under budget.
wasn't part of the.
It was not part of the remodel. Nope.
Okay, that was my, just clarification on that. Thank you.
Any other questions? Hearing none, I would look for a motion to approve the consent agenda.
Mr. Chair, I move to approve the consent agenda.
Okay, we have a motion by Commissioner Van Ort. Is there a second?
Second.
Second by Commissioner Samke. Is there any further discussion? Hearing none, would you please call the roll?
Commissioner Schmidt,
Yes.
Commissioner Samke,
Yes.
Commissioner Van Ort,
Yes.
Commissioner Olberg,
Yes.
Commissioner Johnson.
Yes. Motion carries. Now we have Meeker Memorial Hospital. We have Mary Ellen and Suzanne here today.
Good morning. Good morning.
First order of business is just to review our financial position, and as I indicated earlier, Tyler isn't able to be here this morning, so I hope you're treat me kindly. No, actually, just to, nothing of note, I spoke at length with Tyler yesterday just to make sure, and the Finance Committee of the Hospital Board has reviewed all of the financial statements and have found nothing out of the ordinary, and that we're in a nice position going into the end of the year. If you note, the operating margin year-to-date is at 3.7%. Very healthy. Our total margin is at 6.5%. And if you look at the contractual percentage, that I'd like to highlight is something that has helped us over the years, because we do have a healthy business climate here, so we don't rely strictly on government payers. We have commercial insurance as well, and so that brings our contractual allowance down. So 38 cents out of a dollar. is a contractual adjustment. Medicare and Medicaid are well over 50%. So you can see then that because we have commercial insurance, our rates are much better, much more stable. I'm going to stop there because we do have a longer item on the agenda unless there are questions. One more, I'm sorry, one more I can mention. We've completed the pharmacy project, which is going to move the pharmacy from the old building into the 2009 building. It's been completed, it's ready to go. It came in under budget. Unfortunately, with the government shutdown, we've been severely delayed in getting the inspections that are necessary to open it up. So it looks like it'll be mid to end of January before we'll be able to open it up.
If they close down for 30 days, it takes 90 to catch up. It's kind of interesting.
So is that a state certification that you're waiting on or a federal? State.
Building, Department of Labor and Industry. Their shop.
Okay.
It's quite an extensive process because they are making, compounding drugs and dealing with highly sensitive materials, so it does require quite a bit of inspection.
Well, it's going to be a lot better than where they're doing it now.
Gosh.
That's for sure. So it'll
Gosh.
be good to get it open,
Yeah.
for sure.
Very much so.
Well, I think everybody on this board saw it during the tour and what it was like in there, so, I think we're anxious to hear that you've said it's now open and functioning, which you could do tomorrow if you only had the certification.
Yeah,
Right.
So, okay.
thank you.
Any other questions or concerns? Okay, should we? Andrew, you want me to start, or?
Please, take it away.
I do have to recognize Andrew in his write-up. He summarized so well what we've been working on. You covered in a couple of pages what's taken about 10 years to accomplish. And so we're here today to seek your support for the ambulatory care project. And if I've included the renderings, what we believe the end result will look like. This is a major addition to this community. The structure, it's a 3-story structure that will house the 2 clinics that are currently the East Clinic and the West Clinic. It will house a nice expansion of our rehab services, our lab services. It will move everything out of the 1950s and the 1970s buildings into this new facility. We're going to upgrade some of the space in 2009 building and really bring this campus to where it needs to be going forward. The hospital board has been reviewing this for months and months, making sure we had the due diligence that would support and the evidence that would support this project. We came before you several weeks ago with all of the detailed plans and how we can financially support this, not putting any tax burden on the county, any risk to the county. So I look at the previous leaders of the organization and the hospital board that when you look at these financial numbers, bring us the kind of backing and financial stability that we need to be able to do this project. I'm not sure if I need to go much further.
I just need to say, isn't that beautiful?
It is. It looks fantastic.
I just smile every time I see it because everybody, the staff, everybody has worked hard on this, and it gives me so much pride to look at it. Yeah. And it's going to be facing Sibley, so when you drive by, you're going to know we have a hospital. It's just, and going up, I wasn't all on board for that, but now I am because it leaves space if we have to.
The 3 stories is a smaller
Yeah,
footprint.
right.
I greatly appreciate that.
Absolutely, so that works. So even though it took time, it was, Mary Ellen and the staff did a good job. And the board has worked hard and unanimously come behind the project. And the fact that it costs the taxpayer nothing, and by the way, the hospital never has. We never use levy money for anything. It's very self-supporting, speaks to what a wonderful organization it is. I had to stop up there the other day to pick up some papers, so I pulled in front quick and I went in, and people were 3 deep in front of registration to get in. So that tells you, most people with babies going to the walk-in, whatever. So I just left and came back, but it just kind of, I'm like, yeah, we need this. We just really do, so. It's pretty exciting.
Andrew, if you would go to the next picture.
There's no next picture.
Oh, did you, we at the 3, you only got the, okay.
No, we have 3 on there.
Yeah.
That was the third of the 3.
Okay, go up to the second then. There. So if we look at this, that red car and those trees in the background are actually where that vacant lot is and where the house that Tyler lived in that we're gonna move
Yes.
away.
Yes.
Yeah,
Lockerbie.
yep,
Lockerbie.
on the other side.
Which we closed off part of.
Yeah.
Yeah, we've done all the due diligence. We'll be going back to the city to replat the campus to include the home lots. We'll be also going for a variance on height, but we don't expect, in fact, we've had conversations. It's a few feet over, and they've already granted several of those kinds of height with previous buildings. So we haven't received any concerns. The public hearings we've had, the public, inviting the people in the community to hear our story and why we're doing this and what plans are. It's been very, very satisfying to see the support for the campus.
And you're thinking breaking ground spring or summer?
Summer, early summer. We'll be beginning we've got the schematic design. We'll be moving to the design development, which is this really detailed blueprints, and that takes months. And then they'll go out to contracting, the bids for contractors.
We are gonna do a couple of different bid packages where we're gonna do the steel package and the site work first. So before we actually break ground to put the footings in, we'll be doing the exterior, and that will start next year.
Be nice.
One of the nice improvements you have is, when people have cancer, that's some of the days of their life that are so, but they're gonna have a beautiful setup to look out while they're getting their treatments, because sometimes those chemo runs can be, 6-8 hours?
Treatments can be 6 hours.
Yeah.
It's that low building, the low will be
Yep.
that's the infusion, cancer and infusion center.
So I guess my point is a lot of thoughtfulness was put into this design, thinking about the patient and their experience, so, yeah.
It's
Great
been
job.
good.
The financing, I'll just note, we do have, and that's where the county support can come into play. We're looking at up to 30 million in debt, but that won't come until next year. Tom, Brandy's good friend, is still helping us sorting through what kind of financing we should get, what would be the most.
In the meantime, we'll still be gathering some nice interest because we'll be getting nice interest on our money for the next year also because we're not big into rate.
True.
So, well thought out and a great plan.
And as Mary Ellen noted, the fact that the financing's coming later in the project, the purpose of the conversation today is to get a vote of affirmation from you that you all support the project and that you intend to continue to support it. We don't want to enter into construction contracts and then find out that the county board's
Wait a
not going to
minute, what
support the
happened?
financing and now there's no money and then Brandy's having to fight those arguments within court, so.
So, Mr. Chair, I'm going to make the motion if I can. I'm going
Please.
to move to affirm support of the Meeker Memorial Hospital project and commit to future approval of financing up to $30 million.
We have a motion by Commissioner Olberg. Is there a second?
I'll second that, Mr. Chair.
second by Commissioner Schmidt. Is there any further discussion?
I'd just like to make a comment here. I just want to thank Beth and Paul for serving on the board. And I think, Beth, you've been on long before I was here.
Long time.
So I know this is a long journey and
Yep,
and
it has been.
congratulations
Yeah.
to both the hospital board and staff, to your guys' participation and support. Appreciate it.
I think 5 years ago, 4 years, 11 months, 16 days. You always correct me.
20 hours.
I think my very first meeting at the hospital board, they were talking about a hospital expansion. And so just to see this come to fruition is a great
It does
feeling.
take a long time
It
to get
does.
these big
And as
projects.
long as you wait, the price goes up too. I have to
Yeah.
accept that, so. But we've had, there's been a lot of good leadership and very much appreciated. This is one project that I've thought so important before I'm done, and so to see it go is, we just need a hospital in this community, and we have a good one, so. Good job, everyone.
So with that, hearing no further discussion, all those in favor say aye.
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 Post same sign, motion carries unanimously.
Thank you so much for what you do.
Thank you, ladies.
It's early in the morning, and we came back from champagne.
Yes.
We'll
Who said?
post it.
I don't know if there's a rule on that.
Cheers with coffee.
Thank you.
Support is really, really appreciated. Yes. We're gonna go share it with employees now, and then you'll be seeing about it in the, have a news release and all.
Fantastic.
Thanks.
Thanks, Mary Ellen. Thank you, Suzanne. All right. Tina Schenk, Health and Human Services Director.
I don't really want to go after Mary.
She's a tough act to follow.
There is some lefse over there,
You ought
guys,
to be
if you would
getting
like.
used to
Oh,
Like
you
a
gotta
piece.
have some left, so it's great.
My current Lexa package is gone again.
Intent. Our lefse maker's going to Mexico, so.
I heard that.
What
You know
the
what? I
heck?
do have a Lefsa maker that yesterday was working with my mom.
Oh, really? Well,
So we for Christmas. But. Good morning. We have contracts for you today. We will also have a few stragglers in January. Do you want me just to run through these quick? Yep, okay. We have several contracts that we use for guardianship services. So if you're unfamiliar, at times folks don't make capacity to make medical or housing or financial decisions at times for themselves. This is a court process to assign a guardian. There has to be due diligence that that person is actually incapacitated. And at Meeker County, we also then look to friends, family, or other appropriate folks to do that guardianship for that person, feeling like informal supports are the most appropriate for all of us. However, there are some people that don't have someone that is able to do that for them. So we do have a number of folks that have guardians that are paid guardians there through agencies. We have three primary agencies we work with. And they set rates. They do have a little bit of varying rates. It looks like LSS had updated their rate. And Prairie Support Services has updated their rate, and I didn't realize we don't have Solid Oak in here. Is different in that they charge us a flat monthly rate of, I believe it's $210 a month, but don't quote me on that. There was no change in their rate from last year. Then we have a UCAP. Were there any questions about the guardianships? UCAP, it has some family-based supports that we utilize. So this is folks that will go into the home. They primarily work on parenting skills with families. These families are either at risk, at pretty significant risk of out-of-home placement with their children, or their children have been removed, or their children have recently been returned to their home. So under those three scenarios, this is it's a really effective service. It's also fairly expensive. So this is a little bit more of maybe a third or fourth step when we're working with the family. But of course, we don't want to wait too long. We want them to have the support they need when they need it. But we do have a $10,000 contract with them. To be honest, we're bumping up against that cap this year. I think we might be actually headed over it a little bit. We have the Central Community Transit, or CCT, our busing service. So there are some fees for unloaded miles. Most of those are paid for by medical assistants or a third-party biller like Prime West. We do, I believe, have some cost associated with that on a few cases, but not much. There was a proposal by CCT to move to a pickup fee. We didn't get that proposal from them in this contract. They apparently moved away from that. We had that discussion in June maybe, and we didn't hear more from them about it. So we're just gonna go with the.
Not to interrupt you.
You had brought that to my attention back then, because there was gonna be a rate change and so forth, but it's just kind of,
I'm not sure. We had a meeting because Renville and Candy also have this is all the same contract.
Right.
And they said they would come back with an update because what they had proposed to us, they wanted to change prior to the meeting. And we did not hear back from them again, which it's my understanding that they're financially solvent and this contract seems to be meeting their needs. So moving to a different system at this time, I think we had questions about why we would need to do that, and we asked for some more information and just didn't hear from them.
weren't they going to do something with the billing that was gonna save you a lot of time? That didn't come to fruition either.
That
did
was
it?
through Prime West, I think.
No, this was
this something
definitely
else, too?
CCT.
It's yes. So if they were to become their own waiver provider, right now we are a pass-through for all of the waivers. So our accounting department handles all that.
Yeah.
So if you are somebody under a waivered service, you can have what's called community inclusion transportation. So if you need to go to the grocery store with the CCT bus, or maybe you need to go to a worshiping community or something like that, we give a certain amount of rides per month for that. Right now, we pay CCT for that, and then we bill their medical assistance product under the waiver for just those qualified people. It's not for everyone. You have to meet these certain qualifications and have those identified needs. If they were to become a waiver provider, then we wouldn't be the pass-through. So we have a lot of things that we're a pass-through for, and that does take a lot of accounting time. And of course, if there is an error, which we did have some struggles with that, but we are really nailing that now and keeping a close eye on it, then we eat that cost. So that's the other concern with that. But that part is fine now. We've had that discussion. We've got it now. After some staff turnover, we struggled for a little bit, but that's all taken care of. That would save us a considerable amount of time. It's also very difficult for them to become a waiver provider, so that's something that they would have to consider if they have the capacity for.
Mr. Chair, one of the things, and I'm not going to belabor this, that we've discussed in the past at CCT is no-shows for Medicare, Medicaid pickups. Do we track that, or we don't know, or they do, I suppose, and
I have not, I will say, just from my experience in the past as a case manager, I would get some phone calls sometimes about, can you talk to this person? They're not canceling, they're not showing up. I haven't heard of that happening for quite a while, and I haven't heard figures or stats on that it's been a concern, but I haven't asked.
Okay.
We do now have our office support manager, Amber Prez, is attending the operational board meeting for CCT now, has been appointed to that board to give us that conduit of better communication. So I can ask her that question.
That's fine. If you haven't heard about it, it's probably not happening.
Usually
Which is a good thing.
it's not a problem, but yeah.
Very good. Thank you.
Have you heard of that, Commissioner Johnson?
No, I haven't. That's why I was just when I read this, I thought, I wonder how that, was going.
Yeah.
So.
I have not recently heard. We also have our CSP contract with Woodland Centers. This is a little bit difficult to explain. We get dollars from the state under the Adult Mental Health Initiative funds. This is in addition to the consortium dollars that we also get under that SIM EMHI grant from the state. So each county gets their own grant. We can choose, they're called brass codes, so we can put money into these pots that meet these, for services that meet these qualifications, the descriptions of those brass codes. So we get somewhere about $84,000-ish a year from the state. Part of this goes to the CSP funding source for, this is primarily for folks that are in, their mental health is fairly stable, yet they need some supports. So the medical assistance products that we have that support folks into recovery don't always work well for this population because they have to have an active rehabilitative goal for those programs, and these folks more need just stability. They need some social outlets. They need to build community. As you know, mental health can be very isolating, so it's really intended for that population. We have had overall, and I think this is actually really positive, we've had a decrease in the utilization of this program. So we used to, years ago, we used to give Woodland Centers the entire grant for this funding, for this particular service. We had been giving them about $50,000, and I lowered that the last biennium when I wrote that grant. Unfortunately, we didn't get it coordinated with this contract last year, so we did, you'll see a reduction in this. The thing about this grant with the state is that we can move dollars from those pots of money. So right now, we are, instead of assigning it all to Woodlands and then not using it and losing it, we put that into unfunded targeted case management care, for instance. We have to serve people whether or not they have a funding stream. This can help with some of that. If for some reason we need more dollars to be funded to the CSP grant, we can ask the state to move those pots of money around in the future. So this isn't, I just want to be very clear that it's not intended to be a decrease in service. It's just by decreasing the amount, it allowed us to use that funding potentially for something else if it's available. Does that make sense?
Yes.
Okay. So how this is written then is that, you know, they're, and Woodland Centers is well aware of this, that if they're butting up against that $25,000, let me know. We'll get that approved through the state and we'll add money to that pot. And there's no levy dollars with that. We have the Woodland Center's purchase of service contract, which Commissioner Oberg and I have had many, many conversations about this here. As you may be aware, this is probably our single largest contract with HHS. We are mandated to provide a lot of mental health services under state statute for folks that are uninsured or underinsured primarily. We also have something called a maintenance of effort. When they close the treatment centers, they assign a maintenance of effort amount to each county. And you need to stay at that, meaning that the county continues to spend some money, right, where the state has stepped in to some other pieces. Wouldn't it be nice if there was the opposite of that too? Anyway, so we are really doing well. Our maintenance of effort is over 100%, so we don't need to be concerned about that. This purchase of service contract covers some outreach. We did reduce that line item because, quite frankly, our agency does a lot of that outreach with the various projects that we're doing, like the Suicide Prevention Task Force, for instance. We also have some education and prevention. Again, Suicide Task Force takes care of a lot of that. We also then have folks that have access to therapeutic services, psychiatric services, and something called day treatment, which is kind of like group programming. And that takes up the bulk of this contract. We're working towards doing a post-bill system on this contract. So we have some verbal agreements from all of the 7 counties involved and Woodland Centers to be able to attach those dollars to actual people, not for public view, obviously, but that our agency understands where these are going to. That gives us a little bit more ability to predict, right? Like if the bulk of these dollars are going to youth, then we probably need to plan for that, right? Just as an example. So we are working on cleaning up and moving this contract in a way that works best for all 7 counties, primary counties involved. But it is probably our biggest single contract.
Mr. Chair, I also want to stress it has nothing to do with the work that Woodland is doing. They do great work for us. It's just needs have changed, right? And the contract needs to change over the years, and Tina has worked, and I think Ashley's worked with you very hard with all the counties. Everybody doesn't always have the same needs, obviously, so that's what it's leading to. Hopefully next year will be even better, but they've been a wonderful partner, so it isn't to do with that at all. I think you would second that.
Yes, I should have been more clear about that to
No,
begin with.
just-
Thank you. I think that I wouldn't even call it a problem. I would say that the desire here is to move towards that post-pay contract, to look at where do we need to fund services for our community? Where is that need at? The way that we have it right now is very flexible funding for woodland centers. That's how, because they have this large service spectrum, and they need to be able to have some flexibility in the needs that pop up for them in the year. So how can we balance those two needs so that we also can have data so we can start to be able to analyze and predict and plan for
Outcomes.
service change needs in our community? And I also think there is this aspect of just even just demographically, having that information and understanding. I would love to be able to come and tell you, we served 1,000 Meeker County clients under this contract. I can't currently do that. I can give you some information, but I can't give you as detailed of information as we would like to move towards. So is that
Yeah.
a better way of saying it?
And Woodland has changed, contracts aren't a big a part of Woodland as the whole
Yes.
everything's just changing. So it's all good change. They're a great partner. They're located here. They do a good job.
And I will also just add that a lot of the directors in the 7 counties are new like me. And Dr. Chosted just was very patient with us in walking us through that entire history and diving in and understand, to build our understanding of how we got to where we currently are and what her vision is also for the future. So I think that sometimes when you have to work through these difficult questions, the side effect of that is that you build really strong partnerships. So I'm excited about, I think that we were able to maintain a relationship and build trust through this discussion. I think that our needs are still met by this contract in a really great way, and we're working towards moving that in a direction that I personally feel is more beneficial for me and our agency to understand what we're looking at so we can bring that information to you and the public. Any other questions or comments about that? And Dr. Whitney Rentz, I believe is how you say that, we are required to have a medical director consultant. And I believe that is it for this round. Any other questions?
So Tina, this is basically the same group as we have approved for the last 3 years.
There are no new contracts in this list. You'll see a new contract in the January list, and I can explain
Okay.
that. But otherwise, I believe all the contracts in January and all of these contracts are the same historical contracts with us. And I believe that you've been able to review all of these as well. So they've gone through the county attorney's office for review as well.
Questions for Tina?
No,
If not-
You've done a great job on
Thank
all
you.
these, and I appreciate what you've done, Tina. I just want everybody to know that. It's not been easy, I'm sure, acclimating to it all, so you've done great.
This is not something that has been previously in my house here. Thank you for recognizing that. And I will say, I have some really good help over here in helping me understand what's needed and what we see. And I think that the groundwork that was laid by Paul and by Brandy has been really awesome. Our template contract is really strong for us, and that's their work. So I had an easy act to follow there.
So with that, someone has a very long motion to make.
Mr. Chair, move to approve the 2025 Health and Human Services contracts, including Lutheran Social Services, Guardianship, Solid Oak Guardianship, Prairie Support Services, Guardianship, UCAP Family-Based Supports, CCT, CMJTS, Woodland Centers, CSP, Woodlands POS, and Dr. Whitney Rentz, medical consultation for January 1, 2026 through December 31st, 2026.
We have a motion by Commissioner Schmidt. Do we have a second?
Second.
Second by Commissioner Samke. Any discussion? Hearing none. All those in favor say aye.
Aye.
Pose same sign. Motion carries. You're going to share the stage now?
I am.
I was gonna say, you're not leaving us, are you? But
I'll just move over. I don't need to be in the hot seat anymore. You reserve that for Mally,
That's the warm seat, I believe.
the warm seat.
It's not fully hot.
All right, I don't need my screen up because it's right there. Good morning.
Good morning.
So it's been a year. Mally Dowdle, Eligibility Supervisor, Meeker County Health and Human Services. So today we'll go over a little bit about what my department does. But again, before I get into the specifics of our programs and residents that we serve, I just want to start a little bit about what income maintenance really is and why it matters to our county. It's been in the news a lot these last few months, so you probably have somewhat of an understanding already. But at its core, income maintenance is about helping people meet their basic needs. Those survival needs that they have, that all of us need to have before we can focus on other aspects of our life. So that starts with food, helping families have access to enough nutritious food to fuel their bodies and their minds, and that comes out through the SNAP program. It includes cash assistance to help towards those expenses of the essentials that we need. Housing, utilities, something as simple as clothing, just those basic everyday protections that we come to rely on. And it also includes access to health care, physical, mental health, childcare assistance, all of these that help us support ourselves, our children, help support employment, and just our families and individuals as a whole. Just as importantly as those tangible aspects, these programs help provide peace of mind, the ability to sleep at night knowing that your core needs are met. And when people are not in crisis about their survival, then they're better able to focus on what comes next. The reality is, when basic needs are unmet, it becomes incredibly difficult to focus on your mental health, your personal growth, your safety, your job, moments of rest, which translates into being harder to parent, to be a good employee, good member of the community, because you're in this constant state of worry and crisis. So income maintenance programs exist to create that foundation. While some assistance addresses immediate needs, maybe we can help stave off an eviction, these programs are ultimately about ongoing stability, giving individuals and families the support and access to additional resources that they need to show up fully for themselves and for the people that rely on them. So with that foundation in mind, I'm just going to kind of walk through the programs that we administer and a brief look at how many residents are accessing those programs. So I need to tap it. I think you can just tap it.
Or you can use there's an arrow right there that goes
There you go. Look at that. I could have changed that a long time ago. Okay. So this screen here is just an overall picture of the core programs that we manage. The SNAP food program, child care assistance, multiple cash programs, both for families and adults, and then multiple healthcare assistance programs. So starting with SNAP, one of the big ticket items here. So the purpose of SNAP really is in that first word. It is a supplemental nutrition assistance program. So this program is to provide extra support to help supplement a family's monthly grocery supply. It's not necessarily meant to cover all groceries that a household would need. As of the end of in November, so just last month in Meeker County, we had 735 households open on the SNAP program. So that is comprised of 888 adults and 527 children. And the benefit amount that a family receives can vary greatly depending on household size and income and expenses.
Can I get you to back up one slide? I got a question, it's kind of bugging me. On these programs, and this is something that has been talked about a little bit through some of these work groups that, and I don't know if it's same one, I can't keep track of which one I'm in anymore.
There's a
But
lot of work.
one of the things that's brought up is kind of a restructuring of DHS in general from state level. Of these programs on this, are there programs here that, and this is maybe something just to think about, if nothing else, that we could do a better job of, that we can consolidate and maybe streamline, and I'm not looking for an answer today, but maybe something to think about, just to be aware of as we move through. Things are gonna change in the future, and if we have opportunity to have input and to provide input, what of these programs could we do a better job with? What could we administer more efficiently? Could we combine some of them, or to target similar? I'm just throwing this out there to give us something to think about as we move forward.
And one thing just to kind of moving ahead, but it's not stealing the thunder of another slide, so I'll just bring it up here.
Okay, no, that's fine.
Looking at the cash programs, so this DWP here, which is one of two family cash programs, that is actually going away effective March 1st, so there will only be one. So they are condensing into one family cash program, which I think kind of speaks to what you're getting at.
Yeah.
So they are looking at it with that. A lot of these, especially when you get into the cash, because SNAP, it's all one program. Childcare, it's all one program. Once you're looking at cash programs, where the dividing line comes for a lot of this is also funding sources. What's federal dollars, what's state dollars, which then determines how it gets administered and where the state has the ability to condense and where they can't.
I haven't talked to Mallory about that.
No, I'm sorry if
The resolution.
I just wanted to lay it out there, 'cause.
I think that people with a lot more experience and smarts than me will make those decisions moving forward. However, what I would bring forward is the thought behind what I'd like that decision-making to lie, is what is the balance between how can we make administration of these programs the most efficient, and how can we ensure that our families and our residents in Meeker County maintain access to timely benefit administration. So access in terms of where can they get to, right? We also know that the state has looked at moving more things onto an online application, which is great for a number of communities. In rural Minnesota, not everybody has easy access to internet, or can afford, to do things on a smartphone or things like that. So those are the points of concern for me. I do think that you've all heard that in my opinion, the biggest barrier we have to effective administration of any of these programs that Mally's going to talk about is the technology from 1989, 1990, 1992, right? If that is the biggest barrier that I feel that we have to the administration. If we can get those systems to come into modernization, we will do better. So just as a reminder, people that can apply online for benefits, some benefits now, they apply online, and that online program sends us a fax that we then have to put input into the system again. I mean, when you talk to the public about it, they think you're making this up, right? Like, no one in their right mind thinks that's even a real thing. So these are the areas of concern for me that I feel like we get the bang for our buck, so to speak, in terms of making that administration more efficient. Whether or not that's done in Meeker County or with a more of a state-led effort, I think my concern is the maintaining of access for our residents here.
Sounds like it goes right back where it's always been, right? State.
Well, I wanted to bring it up. I mean, because I think there is going to be some changes. I mean, I don't see a way back with all the things that are being discussed right now. There will be some changes moving forward, and I just want us to be thinking about some of these things that we can, if we have an opportunity to interject our processes and thoughts into this, I want to be able to do that.
Yeah, I think that was a tough discussion. Commissioner Johnson and I were in the room for that vote. Minnesota historically has been county-administered programming. The thought process of moving that to a state-administered system is really a little bit mind-blowing, to be honest, in what that would entail, right? I think that would have to be very thoughtful. Again, I think that the best use of our energy and our advocacy at this exact moment, I'm pretty sure you would agree with me, Commissioner Schmidt, is the technology that we need.
Yeah.
And I think we're seeing a lot of momentum. So it's even possible, do we get that implemented and then see, where that lies at that point?
Yep.
But again, those are decisions that are way above my pick. Good luck with that, y'all.
I agree, system
Yes and no.
modernization is.
Yes and no. I think we need to be at the table.
Yes, I agree.
That's what I'm.
Yep, I would say those are the two main points when we're looking at these programs and how effectively we're maintaining that program integrity and the quality and ease of administering is really modernization. Even the healthcare platform that MNsure runs through, which is decades newer to Minnesota than the Maxis program, still has its shortcomings as well and its workarounds that are very cumbersome for workers. And then in addition to what she stated, I would add policy alignment. All of these programs have such widening gaps. So if they could align more of those policies across the board, that would also help.
Can I ask?
Yep, go ahead. Go ahead, Ben.
I just have a quick question. Well, I think it's quick, but I've read a lot about fraud in Minnesota and about every program that I'm looking at here. Do we as a county safeguard against that somehow, or does that all fall on the state, or how does it?
So the state provides counties with a fraud investigation grant. And our grant goes to Wright County. We contract with them for our fraud investigation services. So Wright County has provided a fraud investigator that Meeker County uses. And we get referrals from several different ways. People can report through the online state portal, which then goes to the investigators. We get anonymous calls here at the county, sometimes not so anonymous calls here at the county. And then also our workers themselves are trying to protect against fraud. So when they're looking at an application or they're doing an interview, they're having those conversations with our applicants, with our clients, to clarify any inconsistent information or red flags. And then if they feel like they haven't been able to get that, they themselves will also send a referral to the fraud investigator.
I guess I look at all this and I think, well, how did we get here? Obviously, they have to provide all the information, and you verify information when they sign up.
Yes.
correct?
We
So
do.
when I look at these billions of dollars, I'm like, I don't understand how we
Yeah.
get here.
The-
So what am I missing?
Thank you for that question, actually, because I think this is a really great point of clarification. Let's take a snap, just so we can make this a little bit easy. So what Mally's talking about with our fraud investigator, somebody comes in and they underreport income for SNAP. Was it, first of all, was that intentional? Was there some, mix-up? We'll look at that as well. But we're talking about, let's assume that they get a $500 a month payment and all of it was fraudulently obtained. That's $500 to that family. What you're talking about and what you're seeing in the news headlines is not coming from our applicants. It is coming from folks that have set up
An organization.
supposed service to serve our communities, and they have fraudulently billed Medicaid in Minnesota's case primarily, but if you look at, I think there's a huge Medicare fraud case in Florida, for instance. That's where those millions and millions of dollars are coming from.
So the
It's
feeding,
not our-
feeding the children, it has nothing, because I look at our SNAP and I think when we were worried about not having it during the shutdown, you said some people get $10 a month,
Yep.
right? And I'm thinking, and you're talking billions. some people get 1,000, right? That might be on the bigger end. And maybe overall, we're talking about a couple of 100,000 a month, maybe, does that? It doesn't matter, but, that's why I couldn't wrap my brain around where is all this coming from? But now I see, it's just man-made, they're just crooks, right?
I think where we need to see the balance point is that, I don't want to talk about this. There has been a lot of attention historically to the programs that are on the screen right now, and the folks receiving that. And this is visible to the community. You know, it used to be you literally had food stamps, right? So there was some potential for community judgment on whether or not somebody should get those dollars, right? So I think that's been a very visible thing. These companies, corporations, and individuals that have defrauded medical assistants, they're more anonymous. We don't see that happening as community members, right? Like, we don't understand where that's coming from, just like you just said. And that's where we're seeing these millions of dollars in fraud. So the balance point to me is we've definitely looked at building in system structure to prevent fraud when we're talking about individuals from our community applying. I think where Minnesota needs to and is working towards changing this narrative is that the providers billing for these services also have to have a high standard of oversight. And the biggest problem in Minnesota right now is this HHS housing program. And that had, like, for instance, a lot of the programs that we administer here, a lot of those waiver dollars, those are high cost things. But if somebody's in a group home, our staff are going there and seeing them, right? Like, we see what conditions they're living in, what is the care they're getting. We have multiple contacts with them. We have face-to-face contacts with them throughout the year, and we have emails and all sorts of phone calls and things like that. So there's some oversight built into that. These programs that were really ripe for fraud have no one else looking at them. No county oversight, no state oversight. So those are the problem areas that need to be addressed first. I will also just get to this now that Commissioner Schmidt and I had a conversation at the AMC conference, just helping, maybe it would be a good idea to come back to you and help you understand what our local agency has done in terms of implementing these points where we do either collaborative decision making, or we have protections in place to try and make sure that we aren't either do fraud, waste, or abuse, right? Like all three. And we do have some processes in place, and we could probably strengthen them as well. So I was going to take some time and walk through with our staff all of those processes and try and get them into some information for you, and I can bring that back to the board.
I appreciate that. I don't want to belabor this and take up your time, but I just look at this and I think, I just don't get it. But now I do, kind of. It isn't this at all. It's just.
Darren?
My question, back up to the technology component of things. My question is do you think that most of the human services teams in the different counties are dealing with the exact same kind of issues, so that they see it the same way, so that when the proposed changes and adjustments and the plan to improve the technology is all pulling in the same direction, and that you're not gonna end up in a situation that, isn't particularly helpful? Somebody gets a contract that they're looking for, but it isn't gonna make a difference. Is there, who does that? How does that work? How, again, I go to how, so that we can have some confidence that, the improvements will truly be the most beneficial to get this thing fixed.
Yep, so of the programs listed on the screen there, they are housed in 3 different platforms, and all of those platforms are maintained by the state. They are updated by the state, and they are used in programs within every county in Minnesota. I guarantee you that if you were to ask any eligibility supervisor or any eligibility worker in the entire state of Minnesota with 100% certainty, they would tell you these need to be updated. There are so many workarounds in all of them. The child care assistance platform was more recently updated than the other ones. There is less usage sheer numbers in that system than the other ones. So I don't know if that played into it or if it's just because it's coming out of a different technology department. So the systems themselves would be the same throughout the entire state. And modernization of those are being advocated for throughout the entire state. The only time where you might see some county nuances are what are known as scripts. And this is in the system that we process the SNAP, the cash, and the disabled based and elderly healthcare in that system called Maxis. Some counties are able to contract to develop their own scripts, which are tools that they can use in the state system. So the state develops scripts that they make available to everybody, but then some counties are able to contract to develop some additional tools for them.
I think we've seen that example from Hennepin County where they have it sitting over Maxis, so it looks like a normal, these are the green screens, right? So it looks like you're just working on a normal computer, not playing Oregon Trail. So those bigger counties that have their own, I think they actually have their own developers is what they have, so.
Cheryl?
Mr. Chair, moving forward, this is off that subject. I notice in each of your progressive slides that you list the number of people, the number of households that you're serving. And so just for perspective, and hopefully, Andrew, you can help me confirm this, how many households do we have in Meeker County? I did look, and the number that I got was 9,100-ish. And so I just bring that up as a matter of perspective. 735 households is less than 10% of our population, and what you do is good, but I think as a community, we need to understand this, there is sometimes a perception that there so many people in the community are getting handouts from the government. And so I just wanted to be clear as we move forward in looking at these numbers, the number of households that we actually have in this county, and those that we are serving, so, okay?
It's a really good point.
So, one last question. Well, I shouldn't say that, I'm not speaking. But I do, help me understand something. If I was a SNAP recipient, how does that work?
Division.
Do I get a card? What can I buy? Let's clear up some of these misnomers that are hanging out.
Households out of 9,100.
So SNAP benefits
Yes.
are issued on.
And these are
what's known as
individual
a
persons in
card.
those households.
Looks like a
Okay.
debit card.
Okay?
And depending on what you're eligible for, again, we're looking at your household size, we're looking at the countable income, and we're looking at allowable expenses. So all of those determine how much of a monthly benefit you are going to get. And then you have a designated issuance date. So on that date each month, your benefit gets put on the card. You take that and you go grocery shopping, and you use it the same as you would a regular. It looks like a regular bank card, as opposed to how we used to have the paper vouchers. Now it just looks like a regular card. That can be used to purchase its food products only.
Okay,
You can't get toilet paper
okay.
with your SNAP dollars. And it needs to be food, and I'll need to double check the specifics, because it's been a while since we've looked into that. But it has to be, I believe it used to be categorized as food with nutritional labels. So you used to not be able to go and get it at the grocery store deli necessarily, because that's more like restaurant style food in a sense. But they may have adjusted that a little bit since I last looked. You cannot get cigarettes, you cannot get alcohol.
Okay.
It really is the food programs, and SNAP dollars can be used at a wide array of grocery suppliers, and they can even be used at farmers markets.
So then when it's scanned, the clerk is scanning it, that determines whether it's eligible for SNAP?
Yeah,
Okay.
I think I've been behind people where they'll use that, just because I know.
Yeah, so
I
then
give
they
a
would
gal
pay
a
for
ride,
the
well, then I'll say you owe $9 for things that aren't eligible.
Yep, okay.
Shampoo or toilet paper.
I just wanted to, because sometimes we have the wrong impression of what they can get.
However, they can go to certain stores and get junk to eat, fully processed meals that are $1 that nobody should be eating, which, They are talking about, I think, taking soda out, which I'm in full agreement with, and sugared cereals and different things, but it all goes back to the same thing, right? What's the closest place that I can go get something to eat in some of these small towns?
Okay.
It's Dollar
And-
General.
It begs the bigger question, if we're, looking at wanting to solve all the world's problems, which would be wonderful, is then, a lot of those junk items that people talk about, why are they using government dollars to buy this food? That's also usually the less expensive food.
Yeah, but not soda pop.
So,
I'm just gonna say,
right, yeah.
not
No, when
soda.
we're talking about food items,
But that's why they go there, yeah, they can
a
get,
lot of times, healthier items are more
Absolutely.
expensive. And especially the fact that we live in a rural community,
Yep.
a lot of people are going to Casey's to get their groceries because they don't have a grocery store.
I think
And
that's why every
it's
small
more expensive
community is
as well.
putting in a Dollar General, because that's where they go, there's no grocery store. It's a whole bunch of stuff.
When you look at our communities in Meeker County, Litchfield has grocery stores. Watkins still has a grocery store.
Not for long.
I think it's
Shoot.
It's closing.
Shoot. And I've heard Eden Valley has,
Just Dollar General.
do they have a,
It's not a,
DG,
well, it's
or the,
it's, well,
yeah,
it's
the market.
It's not the market.
Okay.
But
Does the market one have, this is really off subject, does the market one have fresh food in it then?
the Apple got one, they got like a,
So they have fresh, it'd be nice if they'd put that. Anyway,
But
move us
then,
along, Mr. Chairman.
well, I will, but there again, that's fine. You don't have a grocery store in your community. Now you have to have transportation to get
yeah.
to the grocery store to buy it. So it's kind of a compounding problem. And I have been told I must move this along. So if you would please continue.
You don't want to
And
be
I
here
was,
all day.
I was the one doing all the talking.
Do I get to go to the next slide?
Yes. Much appreciated.
We already did this one, so. Okay, so cash programs, there are family and adult. So again, just family cash program. The main one I'm gonna just is MFIP, this Minnesota Family Investment Program. The other one, which is the secondary one that I talked about, is ending. The last time someone could apply for that was in November, so. And with MFIP, that is a cash and food benefit lumped together under one program. So those are for families. For adults, we have the general assistance, which is meant to be more of an interim program. So looking at general assistance for temporary inability to work, it could be medical reasons, or as an interim income while somebody is applying for Social Security benefits or other benefits. Minnesota Supplement Aid adult program. It can help provide a small supplemental income for people on SSI that qualify. Housing support, which is not the housing support that you, housing stabilization support. So those are for group residential housing settings. A lot of people on some of our disability waivers are also getting assistance through that program. And then we also have emergency assistance. It's emergency assistance for families, emergency general assistance for adults. Really just comes from two different pots of money to separate those. Evictions, utility disconnects, that sort of thing. So in November, we have, I'll just put the family cash programs together. We had 156 people on those family cash programs. So 47 adults, supposed to be parents or other types of caregivers, and then 109, I can math, children, okay? And then for the other ones, we had 74 people receive GA, 75 people received MSA, and we had 83 on the housing support. Questions about that? Okay. And one thing with the family cash programs, if somebody is on that program, they do have access to employment services to work with our counselor over at CMJTS, whose contract was brought up earlier today, to help with supports for them. All right, childcare assistance. This is not so much a tangible benefit that goes to the family, like SNAP, they get food dollars, cash, they get the cash dollars. The way childcare assistance works is it's more of a co-pay type of system. So if somebody is eligible, again, based off of their household, their income, they could have shared cost for their daycare costs. So they would be responsible to pay a portion, and then this program would pay the remaining portion. As last month, we had 25 households on this program, and we have 29 licensed providers in Meeker County. Earlier this year, the state did take provider registration and management in-house. We used to do that at the county level. So the report to pull isn't as easily accessible as it once was, but to the best of my knowledge, this is our total licensed providers.
So unlicensed providers, how do we rate compared to counties of our own size? Do they have a lot more providers, about the same? Or have you maybe never looked at that?
I haven't compared. I know that shortages to childcare assistants, we talked about this even last year, this number hasn't changed
Okay,
since last year. We have not seen a growth
okay.
in providers at all.
The Child Care Coalition has really good data for Meeker County. I don't have it with me today, but we can get you information on how many daycare slots, we have available through all of our licensed providers, and what that gap is and what we should have or what we would need.
What would be interesting is to see what it's like here in Meeker compared to Stevens, where they have the pods and they've done some innovative things. What was the other county that had done something innovative? We heard about them at AMC.
So we just got the Renville.
What-
Renville just did a pod.
That's right, Renville did a pod.
And housing, with housing.
And then where was it? They were doing an apartment or something with daycare in Glencoe?
I would just be curious to see if there's a difference, that's all.
I think, Mr. Chair, we should do a work session and maybe go over some of these, because I have more questions. I just don't want to take up time, just about the programs ourselves, so we all have, and the public gets an understanding.
As chair next year, you'll be able to direct that.
Okay, thank you.
What you're asking could be relatively easy to come by because the DHS does maintain a website, a licensing lookup website, so anybody can look up providers in their area. So that could be pulled relatively easily.
Thank you.
Okay, and then the last one are our healthcare assistance programs. So healthcare is housed in two different platforms. One, which is, the public name of it is Meeker. And that is where for your basic families with children, and then adults without children, and adults under the age of 65. And then the other platform, Maxis, is where if you're 65 and over, especially with Medicare, or if you are needing a disabled basis, long-term care, those are all housed in that platform. And then also through that is where we tie in county burial requests. Somebody who is on medical assistance does have access to additional services, for example, non-emergency medical transportation and trip reimbursement. So they can arrange rides if they don't have a vehicle or anyone that can take them to medical appointments. Or if they are driving themselves or having someone drive them, they can submit for a mileage reimbursement, potentially lodging with prior authorization, meals, parking. So some of those expenses with them getting to their appointments. If they are open on waiver programs, that does give them access to our case managers and those direct supports that are offered to them. And then also we do try to refer them to other supportive services, especially through public health and the programs that they can offer. So last month we had 1,602 households. This data it's easier to pull total case household information. I would need to request a report from the state to get more individual numbers the way I had with my other programs. So this is 1,602 households are on your basic standard medical assistance. So that could be anyone from a household of 1 to a household of 10 or more in some cases. And then for our other programs, for our elder population over 65, blind, disabled, we have 789 people open on those programs. And then we also offer a Medicare savings program through this. It helps pay, depending on what program you're on, it can pay your Part B premium, potentially Part A premium if you have one, co-pays, deductibles, and there are 461 people that were open on that one in November. Questions on that one? Okay. This one is really just more of a visual, just to give you a rough idea of how our process works. So we can receive applications in multiple ways. Tina mentioned people can apply online. They come into the office for a paper application. Maybe they just drop it off. Certain situations, we would even take it over the phone. So lots of different ways for people to access applications for these programs, trying to use the method that works best for them. We get the application, it gets assigned, we complete the required interview, we need to apply all of the policy and procedures, which, to be honest, change pretty much monthly at this point. And then once it's approved, it really doesn't end there. So we've done the application process, we've done the interview, we've requested verifications, we've asked those follow-up questions. And if they're approved and eligible, we still are maintaining that case. So we still are processing changes that need to be reported based off of program requirements. We're processing the renewals. We're receiving incoming county transfers. We're sending outgoing county transfers. So that is just an ongoing process for all of our case maintenance. I think that is it. So at every step of the way, our goal is pretty much the same. We want to connect residents with the programs that they are eligible for. So eligibility, the income maintenance unit, we really do deal a lot with policy and try to ensure that we are implementing those policies as accurately as we possibly can. But we're not just a set of programs and processes. We are investing in the well-being of our community, in supporting those people, our families, our individuals, our residents, with the meals, with money to pay their rent, with access to counseling, all of those additional services that can really help improve the quality of life for the residents in our county. Any final question? Final question?
Questions?
I just have are you getting a lot of questions about people getting letters saying they can't have Blue Cross for their PMAP? Okay. There was some stuff on social media the other day, a lot of misunderstanding. So I meant to get a hold of Prime West and ask them to maybe put an answer out, because people really don't understand what's happening.
When you
So-
say a lot of calls, what's a lot?
I can't quantify how many. Usually
Because-
they're just going directly to the front desk is able to field a lot of those calls. Otherwise, they go to their eligibility worker.
Yeah, they need to make sure they get a hold of, Prime West is gonna have an answer, and they need to do some more here, because the people are thinking, no, I got Prime West, I can't go to my I mean, there was just, I was gonna say something, but I've learned it's not a good idea as a commissioner.
So we,
So, or they say, now, I can't go to Minneapolis. And they also said, Paul, that Prime West sued Blue Cross and took over the entire state. I mean, there's no understanding.
So much disinformation.
Yeah, a lot of so I would suggest get a hold of somebody at Prime West or something.
At the directors meeting, and I apologize because this was a while ago and I'm not going to remember exactly, we were told that Blue Plus had to send out their letters, and then I believe Prime West was issuing letters out.
Yeah, something, a lot of them are just getting them now, and they're just,
And just since if people are listening, will automatically be changed over to Prime West. You will not lose your medical coverage. You won't need to reapply.
they miss that part when they read the letter.
And I don't know, I didn't see the content of the letter sent out by Blue Plus, but I actually just saw Gary Spritznatic yesterday, our Blue Plus rep for this area, and they're well aware, and I think they're good people, right? Like they
Right.
don't want to cause concern, and I know they're also trying to help people understand this conversion.
Yeah, I just think that we need to do a good job and maybe maybe I'll just email them and let them know too that there's some misinformation. It's not a bad thing. It's gonna be fine.
And I think we could maybe, I apologize, I should have maybe been ahead of this, but we could probably do something on our website for an alert or
That'd probably be a
some
good
social
idea.
media. We have limited means to get that out right now, but we could use our family page possibly to put an announcement on.
Okay, good.
But in fairness to Prime West, DHS did not give them that final answer about being the sole provider until, wasn't it mid to late November?
Yeah, and we did not expect this to start till 27.
Seven,
And
so-
they said you're starting January of 20, so that's why we've gotten into.
But I think we have, what, about 4,000,
Yeah, I don't remember, I'm not gonna say.
4,500,
Yeah.
something like that.
Yeah. So-
How many were on Blue Plus? Was there a large number of folks?
Because we were a sole source county before, we don't have the Blue Plus numbers that maybe like Candy, Ohio County.
Right.
has. Of course, they're
Yep.
bigger too, but, you know, Blue Plus was probably, I believe I've seen that it was their primary provider, because they have
Okay.
been sole sourced in the past. So most of our, like if I look at our targeted case management caseloads, right, I would say 2/3 of them are Prime West, and we maybe had about a third transitioning to Blue Plus or had transitioned to Blue Plus. So there's some impact, but I think we probably have less impact than like a Candy, Ohio County.
Yeah.
It doesn't mean that our residents don't, it just takes one
Well, and
person,
then
right?
when
Like they need to understand, so they
It
don't
gets on
have
social
fear.
media and the stories just get, I'm just watching it go, boy, misinformation, you know. So we won't be able to get glasses anymore. My child isn't gonna get the mental health,
Yeah.
you know, they're just picking it out of
Yeah.
the air, so,
And another good thing is Prime West has hired extensively
yeah.
in preparation for this large insurgence of new members. So they're positioned because what did they say? They answer a phone call in person within,
I'm not gonna quote a time, but it's a lot less than,
it's like 16 seconds.
it's quick.
So they're not
You're gonna
going
have
through an
people
automated
working
system
during the
right
holidays
to an
answer
individual.
these questions too, so it's important we get the word out, I think, too.
They have very, they've always been very responsive. In addition, what folks might see if they're going for specialty care outside of this direct region, that those folks don't have a Prime West contract, but Prime West, I've dealt with this personally when as a case manager, working with folks that needed to go like to Mayo.
They cover it.
They'll take care of it. We let them know, they'll contract, they'll take care of it. There should not be any reason why you need to go to a different provider because of this change. And if they have any questions, they can talk to their eligibility worker. Many people with more complicated care also have a case manager, and they are also aware of the change and can help. So just have them call us if you
Yeah.
hear of individuals, and we will see what we can do maybe about getting some.
They must have started getting their letters this weekend, cause that's when it popped up, so.
I do seem to remember something about mid-month, and yes, and I maybe should have myself thought we need to maybe have some
Good.
communication about this at the county level too,
Yeah.
so we
Sounds
can
good.
maybe see if we can get that on.
And we're very fortunate also, Andrew has arranged to have Prime West at our January work session. So, you know, we're gonna be able to ask a lot more deep dive questions and get answers to, so.
I was able to get you one answer really quick before I go. So you asked about Blue Plus. So we had attended a meeting a few months ago, just with Prime West, where they provided some of that data. And as of August, which was the most up-to-date they had on this, there were 572 Blue Plus
Nice.
enrollees that would potentially be affected by this.
I think, you know, I'm a little bit surprised at that high a number because we were sole source before. So,
You know, Blue Plus has the name recognition.
yeah, I know, yeah.
That's what it's all about. They just hear Prime West and they think and they're really a wonderful organization, as you know, but I would take, well, I'm not gonna
And
say.
they're not going away for all managed care services.
No, just-
this specific
Yeah,
demographic.
just the one, so.
Well, I would like to thank your staff, all of them, for the work that they do. It's so important to the residents of Meeker County. Thank you. Anything else for,
I just one thing, and maybe Tina and Andrew, I'd like to get together with you, but MAFPA, so Minnesota African American Family Preservation Child Welfare Disproportionality Act.
Very good job.
Good, Steve. All right.
It took me a year to figure out how to say it. There has been the court has ruled against the pilot program. There's been some, and there apparently in my conversations yesterday, the judge also opened the door a little bit on kind of throwing the whole thing out a touch. There's been some unconstitutionality pieces brought up. So that's something that, and I know you both were in that meeting, and I wanted
Yeah,
to talk to
there
you a
was-
little bit more about that, but this is something we're gonna have to monitor.
Yeah, there was a footnote in the judge's order that made reference to the fact that the whole law itself may stand to challenge based on racial discrimination. And so that would require another party to bring forward a challenge against the law and then another court to make that decision. But that is a possibility. So at this point, there is no ruling that would cause us to have to change our planning. If that comes, we will deal with it. But, we're gonna continue to move forward at this time with rolling towards implementation, because that's what we have before us right now.
Well, Tina and I were in the conversation when the platform amendment came, introduced by Sherburne County, and I was a little bit surprised about the debate on that and how the final vote went.
I think that the difficulty I think most people in the child protection world feel like in general, this act is the right direction for families. We need to do better and we've put that investment here in this county, led by many of you, years ago. So we have seen those changes here. Remember that the rest of Minnesota is not there. We don't have, in my opinion, we need better partnership with the state on effective training and new methods. And I would say we have the receipts here, come see what we're doing, which, many of you have gotten us into those rooms to have that conversation, so I really appreciate that. We need to work ahead stream. We need to be getting families what they need ahead of time. Before it results in child abuse and neglect. And that system was set up to be reactive, not proactive. So however it takes to move towards a proactive system in Minnesota is what we should be doing. Yep. The problem with this act is that it includes and excludes certain families from that. And I think that's the basis of this court challenge. And to be honest, I've always thought, and it's a little, you have to be careful where you say this, so now I'm going to say it in public. We look at every family's needs individually here, and we do our best to meet that need as it is, right? And I think you've heard Kirsten Langerman and her team talk about these basic examples. If a parent can make a phone call themselves, we're not going to do that for them. We don't want to create dependency. But if they struggle, maybe we'll sit beside them. If they really can't do it after several attempts, maybe we'll make it for them. Maybe we'll drive them. And then we're going to teach, right? Like, that's a simple example. But that's how we view it here. I think that should be viewed throughout the state. I think we need more resources. There's some really great movement with the implementation of Family First Preservation Act in Minnesota. Kirsten and I met last week. There's an opportunity for a large grant for 10 projects. We are trying to pull together the Southwest 18 and to support a project being led by Safe Generations. It's just in the absolute bottom start stage. But that would give us access to a whole bunch of training that is high quality. That's what our agency had used. Will help if we need to implement, right? It just lays that foundation across our region. I'm meeting with the directors on Friday and hope to have that discussion with them. So we're going to continue to move forward in those ways, in the ways that we can, and we'll keep an eye on any developments. The other piece that seems to be going in the right direction for us is the reporting piece on this act is the piece that Meeker is going to struggle with, especially with the technology we have now. That appears like there's momentum to move that to a state responsibility. And that is what we need to see happen for us to stay focused on the work, not this. They wanted us to audit every case, which would be probably another supervisor and a case aide. And so if we can get that movement away financially, we're going to be in a much better spot. If we can take advantage of some of these other amazing services coming through Family First from federal dollars funneling into the state, we're gonna be in a good position to best serve our families. And that's really what matters here. So we're gonna keep an eye on everything, and we're gonna continue to do good work. And just to tie this back to what Mally was saying, and when she started her presentation, it's about families having the foundation that they need to be a strong family, part of our community, and to have their basic needs met. So that's what we're gonna keep working on as an entire agency. And that starts actually in the eligibility unit. So we'll just tie that up in a bow for you. But yes, we can have a conversation, and we are watching all of that very carefully and continuing to move ahead.
I had such an advantage in our breakout group because I sat next to Tina and two commissioners on the other side. I don't work in this day to day. So some of the jargon that comes forward, I don't understand. I just lean over to Tina and said, do we do this? Is this something that, does this, how does this work? And she would say, well, then the two commissioners on the other side of me were saying, what did she say? What did she say? So it is an advantage to sit in these type of meetings next to someone who works in a day-to-day thing. So thank you. I know we almost got in trouble for talking so much and Dee was getting agitated with us, so, but that's all right.
Dee will call you out.
With that, I want to thank you both for coming in for your presentation and the work that you do. Thank you.
Yeah, appreciate it.
Thank you.
Yeah, thanks.
I bet you're getting a little nervous over there, Holly. Say, man, they really questioned them something fierce.
Maybe.
Absolutely.
She's wondering if she's in the right time zone.
A little bit. Good morning, everyone. So, annual report for the Property Records Taxation and Elections Department. We are gonna kick off here with ditches. Our responsibility within our department is the financial piece of it. So the billing that comes in, we submit it. We keep a record during the year, and then we do the pre-bill. We usually come in November to get a board approval for what we're gonna collect. This year we did it in December, so those invoices are being sent out to landowners that met that qualification. The ones that don't pay, it'll then be assessed to their property taxes next year. We work with the ditch inspector for repairs that he's anticipating coming up. Funding that we might have to say, hey, we don't have that funding, we have to look at getting a loan for that ditch. That is our responsibility within our office. The next piece we have for the upcoming year is we're looking at the election calendar. So next year we will have, you can see the 3 that are planned. So we'll have March, August, and November. We will also be doing our training for our election judges. That is done every 2 years. The dates and times are yet to be determined. In the past, they have been in June, but we're looking at different dates and times and a few different options of maybe in person and online. We will do a training for myself and one staff member for a week that we go to that's called Train the Trainer. So we will go on site for a whole week, pick up all the new pieces that are coming and come back and then train the judges on that. Our next slide here is our election equipment. So the only difference that we have this year coming in is we have one polling location that is coming back to in-person voting. So we have a few more additional poll pads and one more DS200 that we'll have. Right now, we have done maintenance on them, getting ready for the spring here so we can get them ready for June for the election, for the absentee voting part of it. Up next we have here is licenses that happens within our office. So these are ones that we've done in the past year. We have auctioneer license as people come in to renew them. The fireworks, typically 1 or 2 a year. Tobacco license, transit merch, full liquor establishments, consumption, strong beer and wine, club license, and the temporary 1 to 4 day sale.
I saw this, the first one that popped to me was auctioneer. So every auctioneer, if they have an online auction, if it's a live auction, or, I'm just curious, is this one caught my eye?
If they are gonna be in Meeker County, if they're gonna be doing the auction here, they have to have through our office.
Okay.
So say somebody lives here, but they're doing it in another county, then they're gonna be going there for their auctioning.
I'm just curious, and if you don't know, it's fine. Do you know how many tobacco licenses we now do in the county?
What?
Tobacco, how many licenses we have?
We still have 19, so the two that just came up at the beginning of, well, middle of November, there was two that were sold. So those two are gone and those
Okay.
two were replaced by new, so we still have 19.
Thank you.
And then also on there next year will be cannabis. We don't have that this year, but next year we will.
Probably gonna start licensing real estate
Liquor
people.
licenses, is
I
that
have a
something that the
license.
city does too? For,
Yep, so we take care of townships, so like, I'm gonna use the example, we had someone who came in from Cosmos who was in the city of Cosmos. We won't do anything with that. The sheriff will have to sign off on it, but our office wouldn't do.
okay, that's us. Thank you.
Yep. Also within our office, we do passports. So comparing from last year to this year for first-time passports, we are actually up by 139. And that was to the beginning of December for our numbers. And same with photos, you can see we went up 458. Those would anticipate more times than not being a renewal that people are coming in and doing. We don't get anything for helping process those. We do those as a added benefit to people who are applying. They come in, we'll review it, we assemble it, and they go to the post office and mail it.
I bet a lot of them came in because they didn't have that license, driver's license that you had.
That's right,
If
enhanced
you
or
have,
real
if
ID.
you've got more than one name, it's very discriminatory against women, that whole laws, because you gotta provide information for every name change. You know, if you're Elizabeth Taylor, you'd have to have like 20 pieces of evidence. And the guys just go in there and one thing, so I've been thinking about a lawsuit, but I haven't had time.
We have heard that a lot from people
Yeah.
who, they come from the
just
DMV and they
easier.
go, we need to have this because we're gonna go on a flight in 2 months and we're only going from here to Florida, but we need to have this because we can't get our real ID.
I went down here and they said, Beth, just go get a passport, and I said, got it, so that's what I did.
Use all the time.
Well, and it didn't take long, for whatever it's worth. I was one of the renewals, and so,
Yep, 4 to 6 weeks is the turnaround rate,
yeah.
which is really, really nice.
You can pay a little extra for it
Yep,
a
you
little
can pay an
quicker. I
additional
had to do that.
60 to get it in 2 to 3 weeks.
Well, what is the cost of a passport now, just out of curiosity?
For a 10-year passport, $130.
Okay. Is a renewal the same?
Renewal is the same, so when you are a first-time applicant, you do have to pay a $35 acceptance fee. Once you have a 10-year book, then after 10 years, you can renew it, and it's just the $130. If you let it lapse, you have 5 years to renew it. Say you come in at year 6, now you're starting over and you have to pay the $130 and the $35 again. We also do all of the records for land transfers and associated documents within our office. We do have the DD 214s, which is a military discharge, that can be recorded as well. That is not a public record. That is only within our department that can log in and see that. And then we get requests from other counties through our DD 214 program that they can request that. But you can't come in and request your neighbors. You have to meet certain qualifications to be able to get that information. We do have a Laredo contract that subscription holders can sign with 7 different levels of what they can choose to want to pay per month for that. We do also offer Tapestry, which is a one-time pay. So as you search, you have your card, and every time you search, you pay a certain dollar amount. We do have Laredo at our public computer that is available for the public to come in and use free of charge. We used to have more people that came in for that, but now we have seen that decrease. We have seen a lot more go towards getting their own subscription and doing it out of their offices. We do also on the website on ARCA Search, you can view our track books. They are scanned in, so if somebody's looking for a record from 1980, They can view it on there, they can get a document number, and they can come in and view it. Or they call us or email us, and we respond back to that for them. Up next here is our document counts of how many that have been recorded the last 3 years. So you can see already this year alone, we are up 323 compared to last year. And our e-recording, so that is where someone can submit it from their office and they don't have to mail us a paper. They don't have to stop into our office and drop it off. That's increased by 367 from last year. More times than not, the people that are dropping off paper documents are local offices here in town. And then you can see I have the 6 most common documents from the last year, which makes up 61% of our recording. And our next one here, we offer this free for Meeker County residents that own property. We have a property fraud alert that you put in your information, and every time something comes in to get recorded, that has been recorded, you will either get an email or a phone call from them saying something has been recorded, and that's across the board. So say you signed an easement and that got recorded, you're gonna get a notice of it. So we will have people who will call who will say, well, I think I signed something. Okay, let's look, and we can look up the document they're referencing. And then as soon as we say what it was, they'll go, oh yeah, that's right, I signed that with my neighbor, and we're finally getting that recorded. We also keep record for all of the parcels in Meeker County. So every time we have a split that's done, transferring property, somebody's looking for an address change, that is completed within our office. And then we distribute that out to 2 other offices that use it for Beacon and for the assessor's office as well. We are the taxing authority, so as levies are coming in, we will be the authority for collecting for the state, the county, city, school, townships, watersheds, and special districts. Special districts would be, we have mid-Minnesota. We have a few just off ones that are a smaller percentage that we collect and send back out to them. Up next here is our levy timeline. So I set this from last spring. So thinking of levy, townships already had their levy set back in March. And then now in December, we are getting our final levies, which we will submit to the state in January in our office. And then you can see all the rest of the dates follow out for the year of when we collect, when they're due, and then when they become delinquent. So the first one on here is that January 15th. That was the one I was saying where we have to certify to the state of what the levy is and so forth. On the rest of them, they're all different reports that we have to get submitted in. This would be the distributing of the levy revenue. So that would be where we have that May collection. After that collection in May, we have to settle out that money to each entity. And then all of our dates that we do that are listed on there for the month. And then the bottom is different areas of where we're sending that money out after. Like we collect it for the real estate, we collect for the mobile home. Those are all places that we collect that will get sent out.
Are the mobile home taxes at a different time than real estate?
They are a different time. Does anyone have any questions?
Holly, how long have you been in this position?
In this position, I've been standalone since the end of May.
So how much have you learned since May to now?
A lot.
Sounds like a lot.
And you are still enjoying your job?
Yes.
Good. That's what I wanted to hear.
Every day is something different, and, you know, there's a lot to learn and a lot to teach, and
Good.
we've had lots of staff come and go and training and all the things, so it's good. it's never a dull moment.
Well, thank you for all the learning you've done and what, the services you provide to our residents here in Meeker County. With no more questions,
Holly.
you're off the hot seat.
Thank you.
Sound good? You guys have a great holiday season.
You too.
Thank
Thanks,
you, you
Holly.
too.
And now, on to McKell. And just so everyone knows, after McKell, I'm gonna take a 5-minute break or so we get a break, okay?
Good morning.
Good morning, Mikkel Johnson, Human Resources Director. We are circling back today to the personnel policies. I think the only change since the last policies that you saw, we did add some language that employees who are placed on paid administrative leave and have received formal notice of the county's intent to pursue termination shall not be eligible to receive the cost of living adjustment during that period, unless otherwise stated by a different agreement, like a union contract. And then in the event that the employee is reinstated, their wage should be adjusted to reflect the COLA. So that's the only change that has been made to these policies. I absolutely can read back through the list if you want, or if you have any questions or anything, but.
Are there any questions, or did someone want McKell to recite the list again? Okay, if not, then I would entertain a motion.
Mr. Chair, I move to approve the updated personnel policies.
Okay, we have a motion by Commissioner Van Ort. Is there a second?
I'll second that, Mr.
Second by Commissioner Schmidt. Discussion, please.
What about the Minnesota paid leave policy? Does that include that, or?
Yes, so we are still looking for direction from the board on which direction the elected officials
So
want to
we
go.
have to solve that before we.
Correct, yes.
The way that the policies are written is that it includes, the elected officials will pay 50% of the premium cost. So if you adopted the motion as it was presented right now, it would include that. You could certainly go through the parliamentary procedure to amend that, to pull that portion out, if that's the direction of the board.
I'm gonna make a motion that we pull that out, because I'm still not gonna vote for that.
So you are making a motion to amend
Yep.
the original motion to exclude
Yep.
payment by elected officials. Am I phrasing that correctly? Yes?
Yeah.
Okay. Is there a second? Is there a second? The motion dies for lack of a second.
There you go. What happened to all my friends on this, Darren? Paul,
I don't disagree with you, but I have done research on
let's
this.
just
No,
go
but
with
I've
it.
done research,
yeah, well,
and it's the law, period.
okay, I don't see it that way. But Brandy, do you have any? So we're deciding now for Brandy and the sheriff also.
Yes, all 7 elected officials are covered by this policy.
The law allows an exemption for
For anyone.
anyone, right? And so when you say it's the law, the
It's
law
not the
is
law.
drafted the way it is, but there are exemptions allowed, or exception.
So it's not the law.
It's the law the way it is written, but there are exceptions that you can make and carve out of it as well. And so it's not black and white, there are exceptions you can create.
The law states that employers shall pay 50% of the premium, but may pay more. That's what the law states.
So we can't carve elected officials out. We can or we can't?
You can.
Okay, I just wanted to be clear on that. So it's not the law that elected officials.
So we can.
You can carve them out, however, the county is gonna pay for the rest of it. It's not gonna come out of the elected official's salary.
So that is the key distinction, that they're still covered by the plan, but the county pays the full premium. Just to be clear about that.
But elected officials don't.
I understand, but
This
that,
is so silly.
I actually, Beth, contacted the Secretary of State because I wanted an answer on this. And talk about jargon you can't understand. It's the answer I got, but it was, there are certain things that have to be in place in order for us to carve ourselves out, correct?
Is that what I'm gonna go by our county attorney here. Is that what you
Yep.
understand?
So I think there's a little bit of confusion. So, and Andrew, help me in because you understand the policy side of this as well. The law is created that everyone shall be covered by this plan, and that there is a certain amount that should be taken out of every employee's salary. However, the law allows for the exception or the carve-out for that employee not to have to pay, but then the county will pay for all of it. And so right now, it's the way, what you're discussing is how much should the county pay versus how much should an employee who is an elected official? And all employees are eligible for it. However, elected officials, as you know, don't get vacation and sick time. And so the applicability of it is a challenge. And so the common sense approach is that elected officials will not be using this program.
So if we decide that the county elected officials won't be using it and we don't take it out of our pay, the county's gonna pay it?
Yes.
I'm not gonna, I don't want that either, so that's not happening.
And this point I would make, self-employed, single employee, my only way to opt out of this tax is for me to eliminate, I can go 1099, which then eliminates all my retirement planning, all my,
Yep.
so there's ways for me to opt out, but they're not beneficial to me in the long run, so and I'm the same, I don't get to use earned sick and safe time, I don't get to use, FMLA, or paid family medical, I don't get to utilize it, but I get to contribute to it.
I wonder if there's a
And there's all kinds of people. in that.
possibility
Same.
of some change
Yes.
next year with this
But they
perhaps.
are gonna look at this from,
I
mean, the state elected officials made sure they didn't have to do it.
Well, I think it's gonna get looked at. I think there's gonna be quite a few challenges.
So if I rescind my, well, I didn't get a second, so if I vote for this the way these are, we will pay our own.
Yes.
All right,
further discussion. All right, this is a regular one, so all those in favor say aye.
Right?
Opposed, same sign, motion carries.
I under protest. No, I'm
Oh,
gonna write
that's-
letter,
Oh,
it's
and I
baloney,
am
it's
too,
plain and
but-
simply baloney, and thank you for all the studying you did.
No, it's,
You had an attorney here, you.
I did, but she also has other duties, and in speaking with a lot of different commissioners at AMC, and I did, I talked to a lot of
Sometimes you
them.
gotta forge the way, Mr. Chair, for things. You gotta take a chance and move forward on stuff, and this is one of the things we should have done but not by having the county pay it. That's not an answer
No,
for me.
that's not the way to do it.
When I was speaking with my colleagues who are also elected officials at our annual conference, a lot of this discussion didn't happen at county board meetings, and so the policy kind of just passed through.
Right.
So when I was addressing this with other county attorneys saying, you know, what kind of legal advice are you providing your county board? They said, what policy? And so I think we're at an advantage that this was actually provided as a consideration for this county board to talk about, because I don't think that was happening at most county board meetings. And so for the exposure for this issue to be brought to light, I think is an important piece if that's a policy position this board wants to take.
So next step is we have to try to get legislatively get it changed.
That would be correct.
All right, thank you, Mikhail. At this point, I'm going to take a brief recess. We'll take about,
Did we vote on it?
Minutes.
Oh, we did.
Yes.
and then we'll start back up with Andrew Letson. So we're on break.
It will get raised again.
We're on now? All right, we now have County Administrator Andrew Letson to talk about our property tax levy and the resolution.
Yes, thank you, Mr. Chair. I'm going to be fairly brief about this since we've had several discussions, including our public hearing 2 weeks ago about it. So just some highlights, our 2026 annual budget has $46,448,540 in total expenditures, which is about 11.1% decrease from the previous year. We are looking at a property tax levy of $19,010,391, which is a 9.16% increase over 2025. We have several significant planned expenses within the budget, including an upgrade to our office software, which has been ongoing and rolling through. It's primarily license costs that are new in there. Resurfacing of the courthouse parking lot, replacement of air handlers and temperature controls at both this building and the other building as well for $444,000. Replacement of our West Ripley Playground. Pavement maintenance and vehicle replacements, which are annual maintenance projects that are occurring in our, on our highways, as well as some road and bridge construction projects. There's some new mental health service costs that are impacting us, primarily with two individuals whose level of care changed at St. Peter's for $300,000. Our squad car replacement outfitting, annual replacement of 5 squad cars, upgrade of our security camera server, replacement of a boat and water patrol vehicle, and boat itself for $100,000, which actually we're searching for a grant for right now to try and mitigate the cost of that on the county. Upgrades to our jail beds, election equipment, which our property records taxation elections manager talked about earlier today. And as we talked about just a little while ago, $70,000 for the implementation of the Minnesota Paid Leave Program. As we look at the revenues in our budget, as has been for a long time, property taxes is our primary source of revenue, and then followed by state payments and some federal payments to the county as well. Personnel costs continues to be the largest, the plurality of the cost of our total budget, about 47% of the overall costs. When we look at the operating budget, it's around 57% when we pull out the capital expenses. But beyond that, we have a variety of maintenance agreements, service charges that are a significant chunk of the budget too. So with that, we'd be looking for a motion to adopt 2 resolutions. One adopts the property tax levy for 2026, and the other adopts the annual budget.
Mr. Chair, I move to approve a resolution adopting the 2026 property tax levy for Meeker County and a resolution adopting the 2026 budget for Meeker County.
Okay. Motion by Commissioner Oberg. Is there a second?
I'll second that, Mr. Chair.
Second by Commissioner Schmidt. Is there discussion?
Only one line item on there, on the 2 folks that we have in St. Peter. Is there any, that's ongoing?
It's ongoing.
We don't have okay,
No end in sight?
at this point.
It's not at this time.
We
I
gotta
just
hope
wanted
we
to
don't have
verify
to add any more.
Keep picking on me, we will.
Oh, I'll try not to. I'll try to lighten up, Paul.
That was humor.
All right, we have a motion, a second. I hearing no more discussion. Corey, would you please call the roll?
Commissioner Van Ort,
Yes.
Commissioner Samke,
Aye.
Commissioner Schmidt,
Yes.
Commissioner Oberg,
Yes.
Commissioner Johnson.
Yes. Motion carries.
Okay, thank you. The next item we have for your discussion is a resolution establishing the salary, per diems, and expense allowance for commissioners. We talked about this in August at the work session, and it provided information in the packet. This chart here shows the current 2025 salaries for Meeker County versus our neighbors. As you'll note, salary-wise, your salaries are the lowest compared to all of our neighbors, with Renville being the closest at $31,558. The per diems do match what McLeod does, but Stearns, Wright, and Candy High have all eliminated per diems. In the past, you have not always matched what we have done for our contract and non-contract employees. The last 4 years, the cost of living adjustment for the rest of staff was at 3%. Last year, you did a 3% increase as well. But you can see at the bottom here, as we look at this 10 years, for cost of living adjustments across the board, a total of a 26% increase. For commissioners, we were at 22.4, so we are lagging a bit there. The mileage, we always set at the IRS mileage, which I checked yesterday. IRS has still not released mileage for 2026, but the way we have the language written in the resolution, it's the IRS rate, so there's no specific action you need to take on that. I've provided a few different options for you, or 6 different options for you, ranging from a 1.5% increase to a 4% increase. As I said, before, our budget anticipates a 3% cost of living adjustment for commissioners, which aligns with the anticipated COLA for all of our other staff. At our August work session, the conversation that we had at that point was a 3% salary adjustment and a flat per diem of $100. But certainly that doesn't mean that that's what you need to do today. That was kind of the conversation that you were all having at that time. With that, I'm available for any questions that you might have.
Any questions for Andrew? Is there anyone that wishes to make a motion?
Mr. Chair, I move to approve a resolution establishing the commissioner's salary at $30,000 for 2026, commissioner per diems at $125 per day and $75 per half day.
We have a motion by Commissioner Van Ort. Is there a second?
I'll second that.
Second by Commissioner Schmidt. Discussion. Okay, hearing no discussion, we will call the question. Corey, would you please call the roll?
Commissioner Samke?
Aye.
Commissioner Schmidt?
Aye.
Commissioner Olberg?
Aye.
Commissioner Van Ort?
Yes.
Commissioner Johnson?
Aye. Motion carries. Personnel adjustments, Andrew.
Yes. We have, excuse me, slide behind there. All right. Before you is a resolution that approves the personnel adjustments that are included in the 2026 budget. With that, we have a 3% cost of living for non-contract employees, no new full-time positions. We had 3 positions that the class committee reviewed as part of the compensation study that we do on an annual basis, recommending for adjustment, and that's the IT assistant position to B25, the network administrator to C41, environmental services technician to B23. Beyond that, there were no other reclassification requests outside of the compensation study. The resolution also states that we will continue to work on our 3-year program with David Brown Associates.
Mr. Chair, I move to approve a resolution relating to personnel adjustments included in the 2026 annual budget.
Okay, motion by Commissioner Olberg. Is there a second?
Second.
Second by Commissioner Samke. Any discussion? Hearing none. Corey, would you please call the roll?
Commissioner Olberg?
Yes.
Commissioner Van Ort?
Yes.
Commissioner Samke?
Aye.
Commissioner Schmidt?
Yes.
Commissioner Johnson?
Aye. Motion carries.
Right. Last up, we have various committee appointments. At the end of each year, we have a number of folks whose term comes and expires. We have 4 committees in which we have vacancies that will be starting January 1st, and some applicants for those. So we have 1 vacancy on the aquatic invasive species. We have 1 applicant, Jeremy Johnson, that is to complete a term that ends on December 31st, 2027. Board of Adjustments, we have 2 vacancies and 2 applicants, Galen Nyman and John Smith, both of which would be reappointments. The Extension Service Committee, we have 2 vacancies and 2 applicants, Gail Schiefelbein and Tim Erickson. Tim Erickson will be a reappointment. And on the Planning Commission, we have 3 vacancies, 2 applicants, Greg Early and Corey Salzel would both be reappointments.
Questions for Andrew?
There are 3 vacancies and only 2 applicants for the Planning Commission.
Correct.
Can that vacancy be filled at any time, or will it be
Yes.
vacant for the whole year?
It can be filled at any time when we get an applicant. So we'll leave a posting open and see if we can get people.
Okay,
So
thank-
if you know someone who you think would be good to serve on the Planning Commission, encourage them to apply.
Did I miss, who did not reapply on that?
Derek Schreiber.
Derek Schreiber, okay, there I see it. Okay.
On the Board of Adjustments, that's a 3-member board, correct? With 1
John Smith is the alternate.
Oh, yeah, so that, and
Yes.
that's the way it's,
Yes.
okay.
Mr. Chair, I move to appoint Jeremy Johnson to the Aquatic Invasive Species Committee to complete a term expiring December 31st of 2027. To reappoint Galen Neiman and John Smith to the Board of Adjustments for 3-year terms expiring December 31st, 2028. To appoint Gail Schiefelbein and reappoint Tim Erickson to the Minnesota Extension Service Committee for 3-year terms expiring December 31st, 2028, and to reappoint Greg Early and Corey Salzel to the Planning Commission for 3-year terms expiring December 31st, 2028.
Okay, we have a motion by Commissioner Schmidt. Does anyone need that motion repeated? Otherwise, is there a second?
I'll second.
Second by Commissioner Van Ord. Any discussion? Hearing none. This is standard, so all those in favor say aye.
Aye.
Post same sign, motion carries. We're now going to look for a motion to move into closed session. As a reminder, I'm gonna beat our county attorney to this. We have specific items that we can only discuss during this closed session, so I'm just saying that now as a reminder. So I would be looking for a motion to move to closed session.
Mr. Okay,
I'll make the motion.
I'll second.
Okay, motion by Schmidt, second by Van Ort.
And to be clear, that's pursuant to statute 13D05 subdivision
statute.
3B for attorney-client privilege and subdivision 3A for the evaluation of the county
I'm
administrator.
sure that's what you said, wasn't it, Commissioner?
That's exactly what he said.
All of it.
And I just want to also clarify that we will be talking about two subjects. They will be in separate closed sessions. One will be, we'll start the recording when we discuss the second item. And so want to make it very clear to the public that we will make sure that we have a prompt and crisp break between the two subjects and they will not overlap.
Okay. And that once if this motion is approved to move, we will be reconvening for the closed session in the office adjacent to yours.
In conference room,
Upstairs.
downstairs.
So, with that, all those in favor of moving to closed session, say aye.
Aye.
Pose same sign. We are in closed session. Please bring any material.
All right.
All right, we're now back in open session and for consideration of any resolutions or motions following closed sessions. Do we have a motion that we'd like to bring forward?
Mr. Chair, I would like to make a motion to approve the exceeds expectation rating in the 2025 County Administrator Performance Review and set his 2026 salary at $165,000.
Okay, we have a motion by Commissioner Van Ort. Is there a second?
I'll second that. Mr.
Second
Chair.
by Commissioner Schmidt. Is there any further discussion? Hearing none. All those in favor say aye.
Aye.
Pose same sign. Motion carries.
Is that okay?
You had a very positive performance review.
Welcome.
I appreciate it.
Thank you for all that you do. It's greatly appreciated.
Well, I sincerely appreciate the partnership that I have with all of you. I couldn't do my job without a good working relationship with this board, so thank you.
Even when I have a temper tantrum. I
Yes,
get
but-
over it, though, don't I?
You'll be working
always-
so much closer with Beth next year. I mean, you have a chance to mend anything that's gone wrong.
Likes me, I don't try to.
Fortunately, it's not the first time that
No.
I've worked with Beth as
It's
the
the
chair.
second.
Time you've been chair.
If you bring Lefse, it really helps.
I know, I've got my gloves on.
All right, what do we have left here? We have committee updates.
I actually also have a quick report that we skipped
Oh,
over.
I didn't see it on.
From,
That's good. Thank you.
Yes, four things, really quick. First, we received a letter from the Historical Society, which I emailed to all of you this morning, for your consideration. So, consider. Second, our offices are gonna be closed December 24th and 25th in observance of the Christmas holiday, and on January 1st in observance of New Year's Day. We do not have a work session scheduled for next week. And so for that reason, I'm taking vacation all of next week.
Hey, good for you.
Wonderful.
The last thing I just wanted to say is that, kind of as a closing thought on the year, this year we've had many challenges. And we've been able to tackle those challenges, seek creative solutions, and advocate for our needs, and ensure that we remain in a strong financial position. I think we've been successful in each of those areas. We're able to do this because of the phenomenal staff that we have working here in Meeker County, the wonderful department head team, and the good fortune of working with all five of you every day. We couldn't be effective without the support of all of you, so I appreciate working with you through 2025, and I look forward to continuing that relationship in 2026. That concludes my report, Mr. Chair.
All right. Well, I bet we don't have too many committee updates, since how we only had a couple of days after our last meeting, and then we were all at AMC. But Beth, are you prepared to start?
I guess we had Prime West, right? Put it on that. I had the finance meeting. The finances are better than they've been. We're doing better. The one concern has been pharmacy. There was like a $700 million increase over the year in pharmacy. pharmacy because of the brand name drugs that are being used. And autoimmune things like rheumatoid arthritis drugs and things like that. We had, I don't know if I put anything down. We had the regular meeting and we had some legislators there before our regular meeting, and I was disappointed. We didn't have anybody, how many were there, Paul? 4?
3,
3.
Mary,
2 that
Tori, and Baker.
sat behind, so.
We had representatives from Fishbox office.
Right,
Representatives.
representatives, but not her.
Yep.
So, Paul probably has more notes on that. I mostly had on the, I had a SHAC meeting, that's State Community Health Service Advisory Committee for Public Health for the CHSB, and I'm chair, then you serve on that. That was about a 4-hour meeting. I went in remotely. They talked about population health. Kaisa was part of a presentation that they did on public foundational, which is something they came up with a couple years ago when they had a lot of money for, so that was interesting. Talk a lot about data and stuff. Performance measures. We're accredited. This gets complicated, so I'm not gonna even get into a lot of it, but we're already accredited, so that's gonna be a benefit for us when we get money. And hopefully others are gonna get accreditation, which we wondered why we needed accreditation. Finally, we found a reason. This was kind of interesting. The commissioner of MDH spoke, Brooke Cunningham, and she started out by saying, things are very divided right now. And then went on to say, Minnesota is being targeted because Walz ran for vice president, at which time there was a lot of things from commissioners coming up in the chat trying to explain that we weren't being targeted, but there's a lot of fraud and things going. So when you're setting up there saying, we gotta stop the division, and then you say we're being targeted, she didn't quite know what to say. So that was kind of funny, but, so I had that. What else did I have? That may have been all. Well, we talked to, one of the issues too they talked about, and we talked about this at Prime West, is the tribal land, the tribes, and trying to connect public health with them has been a struggle. I think on Prime West, we had somebody from Beltrami that was, we appointed to the board, and then he just quit coming. Yeah, they're having the same struggle. So they're doing some forums on trying to find out how they can get their leadership interested in what's going on with public health and helping them where it's needed. Then I had CMJTS. I also did that remotely. We had a presentation on the shifting markets, training the job seekers. One of the things, and I think maybe you're aware of this, one of the things that they did this survey is people really, when they apply for work, really get upset if they don't hear back from you. And that's still out there. Like if they have to call you, they assume if they haven't heard from you that they're not getting a job. So they talked a lot about making sure even if you don't decide, get back to these people and let them know where you are in the process.
That is something that we've worked hard on doing. As candidates are dismissed out of the system, they get notification at the time that they're dismissed. And we also work hard to move quickly so that it's a short time frame from it closing to the point that because we have that same concern.
Yeah, there was also a lot of data on, I think it's on Deed's website. They did it's interesting reading if you have time to take a look at it. Looks into the counties and where things are and where we're coming up short and some different things. And some of that data is coming from job counselors. So that was interesting. So if you get time to take a look at it. And I think that's all I had, maybe.
Okay, Cheryl?
But I wasn't at AMC, so.
I will say that AMC conference was excellent this year. The speakers were great. I really appreciated what they had to say. Won't go into all the different things that we attended there, but it was a good conference. I had a Pioneerland Library meeting, and also the Executive and Finance Committee. Revenue and expenses are on track. Lori Ortega is retiring, and we're looking, for a good transition, so they've hired a company to seek out a replacement for her. I'm not sure how many years she's been there, but yeah. We had an extension committee meeting Steve and I went to. This is just before our last meeting. I really appreciate 4-H. I think they do a great thing with kids. The total state amount of participation in 4-H has gone up 10% this year. Meeker County had 78 new participants in 4-H, and then they retain 76% from year to year. So new kids are coming in, but they're still keeping the previous. Average kids are in 4-H for 7 years. The educators on the extension committee, which is crops, livestock, and horticulture, they delivered over 2,100 events. And they also do a great job, and we spent quite a bit of the meeting time on giving feedback on their performance. Had an HRA meeting. HRA is currently serving 77 families, households. They had an audit. That audit is complete. All is good. They renewed the contract for the executive director for 2026, Carla Lundin. But they are sending out an RFP in 2027. So they're putting together a draft of that, and so she does want to continue, I believe, but they need to, on a regular basis, I believe, there does need to be an RFP sent out.
They have a
so.
long waiting list?
I don't know.
Yes,
They
they
do.
do.
Do they?
They do have a long waiting list. There are individuals on our waiting list who are on
Well-
other HRA's waiting lists.
Yes, and they have stopped, except I believe they put in, because there were maybe 300 or so on the waiting list app. And this would be probably last spring or summer when that number.
They just stop.
They said, yeah, we just won't accept any more applications at this point.
But because a person might be on multiple waiting lists, when a slot opens up, it might be 10 people who they go through before they finally
Before they
someone
get
who's
to
still looking.
someone.
So it really is a great information.
It's good information because it's a sense of how much contact they're getting with people who are looking for affordable housing.
Yes, it is a large waiting list, so.
Thank you.
The other thing was there were 2 Zoom meetings for general government policy, right before AMC. And, so we reviewed all of the platform amendments, and those who put forward the amendments went over those, and that was a great amount of information, so that when we did get to the conference, kind of knew what was prioritized, so that is it.
Yeah, I was in that same review of the policy committee's information. Been to the Mid-Minnesota Development Corporation meeting last Wednesday. Big thing from that is that a lot of their loans that they've provided some businesses, they've come back and paid them back, and so they're kind of got some money sitting in the bank that they're really looking to be able to use and to connect with some businesses that are looking for some support. So that's real positive. Also, just did an online thing for the internet security, then did yesterday did the Family Resource Center. That was really good. I thought that was a pretty well put together exercise. A lot of brainstorming. Interesting that you have a number of different people from different perspectives, and they're kind of coming at the need for the Family Resource Center to provide a few different things. Some people were focused more on transportation. Some people were a little bit more focused on the Health and Human Services, providing just resources for people who don't know where else to go. So I think that's a positive start. Andrew was there.
Yeah, I was there too. What I think was resoundingly heard out of there is there's not a desire to create something new, but be a resource for people to find existing services.
And that's what they were saying too, because, and like I said, that it kind of went back to the assets model, which I've been very familiar with over the years, and I was happy to see that that's kind of where they're coming from, but, also just the fact that it's just getting the resources to the people and how evident it was that we have an abundance of a variety of opportunities to help people with their needs.
Is there a physical location determined?
No.
We're not at that point yet. What our group had talked about was starting some of this, what can we do that's kind of low-hanging fruit? And part of it is, do we start with some sort of a digital platform where people can go and find resources? And then from there, grow into like a mobile family resource
Pop-ups
center,
or something.
pop-ups that we have a number of communities, number of cities, all who have some sort of a community room or meeting space within that community. So can we start to leverage those? Can we use the library that's in, Grove City and Cosmos and Dassel, those different sites that already exist that people are already going to bring in resources and things like that. One of the conversations that another group had was a mobile WIC clinic, things like that. So part of the idea I think that's being generated from this is what we don't want to do is create a physical site somewhere in the center of the county that people need to come to. We want to go, we already
To them.
have that.
Okay.
So we want to go and create a mechanism that allows us to bring those services to them, particularly because we know transportation is a significant issue for a number of folks.
Okay.
And it was nice because last night I reported to the Dassel City Council, and I was able to kind of mention that there was a lot of support for making sure that we're reaching out and that Dassel could have some access, that the county and these things are really taking, the city of Dassel into consideration as the second largest.
One of the things that the consultants mentioned as well that we have going for us that some other places don't necessarily is we have a really long list of partners.
Yes.
Providers and
Operation.
entities across the county that are involved in helping families in one way or another, or interested in helping families in one way or another. And so that's a real positive and something that we can continue to leverage.
Who's in this group, or what agencies?
I would say it was vastly,
It was mostly county folks.
yeah, Health and Human
Yeah.
Services folks.
The Lutheran Social Services had folks there as well. Eden Valley Watkins and Dassel Cato Schools each had someone there. Principal from the Dassel Cato High School and a social worker from Eden Valley Watkins.
AGC.
Oh, it was ACGC, not Dassel
ACGC.
Cato. And then one of the ministers in town was a part of it as well. A couple other folks I'm not thinking of off the top of my head, but it was primarily county folks, but several outside partners too.
And so that's one of the things I was mentioning to the folks that Dassel City Council was saying, hey, this is something that I'll speak up for us and
Yeah.
rest assured that we're taking Dassel's needs into consideration, but, it also might not be a bad idea to have some connection and representation too, so, yeah, so I think that's where I'm at, so, done?
Okay, Steve?
All right. Well, I've been, as Tina and myself talked about a little bit, I sit on a SNAP subcommittee and then also on there's SNAP subcommittee, Medicaid subcommittee, and a long-term LTSS subcommittee, and then there's a steering committee above that. So I sit on the SNAP and the steering committee, and we've had multiple meetings, at least 2 each a month, so about 4 meetings a month. And a lot of discussions on, the federal cost shifts and state cost shifts, and really, I think through all this, and that's what I was referring to earlier too, is that we're gonna see a different looking DHS delivery service in the coming years. I don't know how long that's gonna take, but it's starting to be, to me, it seems very evident that that's the path we're going down, and there isn't much resistance to that, making that type of a move, the way it looks. So I've been in several of those meetings here lately. I had a public safety Zoom on platform amendments before the AMC meeting. Then the Friday before AMC, we had the Big Four, which is Minnesota League of Cities, AMC Executive Committee, School Board Executive Committee, and the Township Executive Committee. And this is something we started up again this year. It was something they had done for a while and it kind of fell apart. And this year we started that back up. So we meet about 3 to 4 times a year, kind of quarterly if we can, and just talk about different things. We had Senator Rest in there and a House member from southern Minnesota, kind of Fillmore, Norman counties down southeast portion of the county. They both were on state budget. And one thing they talked about in there, and then we heard it again, an MRC meeting on Sunday night, was the last spring, the $6.2 million structural shortfall for state budget coming up in 28 in the next biennium. Well, now lately you're hearing these numbers where there's $2.5 billion of cash on hand and about a $3 billion shortfall out, structural deficit. Well, if the caveats in that is for the first time, there's no bonding numbers in those numbers. So these numbers that sound a little better right now, there was no bonding in there. So you have to take that into account. And then also, if they spend the $2.5 billion in this session, that gets sewed back on to the $3 billion. So really that $6.2 billion shortfall that was last spring still pretty much exists as is, maybe a little less than that, but not much, 5.5, 5.8 billion. So still a big shortfall coming up, and is gonna keep a lot of challenges on our plates moving forward. Then we had AMC. Obviously, we're gonna miss Neil Galswick from Cass County as our past president. He's a good, steady leader on the exec board, but we welcome Jenny Mojo from Clay. She's gonna have, she's very involved and gonna be very active and a good asset coming on the board. Then on Thursday, when I got home, I went to Meeker Motion, was in Eden Valley and Watkins. So I went to that out in Watkins on Thursday morning, and then went to Watkins City Council meeting that night. Also been this is our last week of Leading on Purpose, which is the AMC online course that, Andrew's on that, myself, Missy and Holly, I believe, are the 4 from the county. So kind of a nice, good class that there's some tools we can pull from that. So. And then that is about it. I think that covers everything I can think of right now.
Okay. Well, I don't have much. Prime West, Beth has already reported on that. I don't really have anything to add. AMC, you guys have covered that really well. On my way home from AMC, I did get a call from a resident out in Collinwood Township about snow plowing. And he said, well, you guys don't plow in the daylight. You don't do this. You don't have several things. And I said, well, tell you what, why don't you send me a text? I'm driving right now. Send me a text with your address and let me get back to you. And so I contacted Phil. Phil gave me the information I wanted to hear. What time we hit that road? Was the plow down? How does it work? What's going on? Has staffing affected it and so forth? And I called the gentleman back then, and I got a nice thank you from him. He said, I wanted to thank you again for getting back to me yesterday regarding my question on plowing roads. As you said, it wasn't the answer I wanted, but I completely understand the situation once you explain things. And I wanted to bring that up because I went to Phil. Phil gave me the correct information. I got back to the guy with the answer he did not want. He was very understanding at that point. And I had told him about our staffing shortage and that we used to have an extra truck, but there's gotta be a first and there's gotta be a last. So the last sentence in his email said, I will definitely let you know if I think of anyone who might be interested in driving a plow truck.
Great.
So, and I forwarded that on to Phil because, those guys get pounded during these snow events.
Yep.
With all the things that
I
are
had
going
phone
on.
calls about ice this weekend.
Yeah.
That it, I'd like 3 different ones, and then the normal. But when we get to the McLeod County line, there's a difference. I was gonna drive out there, but I didn't.
There is a difference, and Phil explained that to me, is because this gentleman lives on the border between Wright County and Meeker. Those
it's
counties
always
use
the
a higher
border.
percentage of salt in their salt sand mix.
Well,
And so
why-
they do
well, why
clear
do we
off
do
there.
that?
That's
a
better for our
discussion
roads, number
another day,
one,
but-
to not use the higher percentage, so.
No, but it's hard on people when they can't drive either. They said it was bad, so.
But
I had a call too from a resident, and he said this road didn't get plowed, so I got a hold of Phil, and he looked it up, and he said, yeah, he's right. He said we did miss, and it was a stretch. It was
Yes.
he's the only guy on the half-mile road, and
Yeah.
and Phil just said, he goes, that one we missed, he said, because, we had a couple new guys pop in that route to help out, and he said they weren't familiar with it, so he said that we did miss it, so.
It's that
But that
GPS we
GIS
put-
is nice, cause
That, I
Yes.
agree.
that
That's
just
great.
tells what time it was
Yep.
and
Yeah,
everything.
he knows, if they
Yeah.
did miss it, they missed it.
I had a call as well, and Phil got back to me really promptly, same situation, where, yep, we did miss that spot, and we're on it, so.
Yeah.
Yep.
Yeah, yeah, you call Phil and he's so quick at getting back, and when you call your resident back, then it's so nice to give them the data.
Yep, and they
Yeah.
greatly appreciate it.
Yeah, they do.
The tone in the
They do.
second call was much nicer.
All right, do we have any other business to come before us?
Yeah, the only thing I'm gonna add is when I said the legislators were there at Prime West, they did say that it's important for commissioners, you know this, to be down there and talk to our legislators. He said, whether you know it or not, your voice makes a difference with those people, cause they know where, you know. So go more often, call them, talk to them more often. He said the
Get to know
commission-
your
yeah,
legislators a
it's
little bit.
important.
And one thing I was always told too is like corn growers, Farm Bureau, soybean growers, multiple agencies, are lobbying, have platforms, same thing we do. But when you talk to legislators, they say, commissioners carry a different weight than them. Them ones are, those agencies more support our arguments if we're aligned versus us supporting theirs. They worry about our platform.
That's kinda what
first, so
he
it's-
said.
And I really did like what Julie Ring, when she got up on the last day and talked about those 3 targets. Instead of, yeah, we still have a lot of other targets, but we're gonna focus harder on those.
We had a lot of discussion in that, and actually, there was 5, and are we taking 1, are we taking 3? And I said, I'm more of a 1 to 3 focus. And we're focusing on the things that we expect to be talked about a lot and that have a large financial impact to our county. So focus on them. All the other ones are still in the book, and they're still on, they're still on the watch list. And if they come up, and there'll be some that probably pop up that are not on a list that we're gonna have to shift and adjust to and make accommodations for, so.
All right, with that, we are going to adjourn as the county board and reconvene in a work session. And the only